Okay, so I called the meeting to order at 6 p.m. And certified that the open meeting law requirements have been met. We're looking at a 14-item agenda. Item number 3 is public comments. So if there are any members out there in the public that would like to make a comment, call 715-538-1770. I'll ask for a second time. Anyone out in the public that would like to make a comment, please call 715-538-1770. Kathy, would you like to make a public comment?
No, I'm here in case somebody does.
And third and final call, anyone from the public that would like to make a comment, 715-538-1770. Since I don't hear the phone ringing off the hook, we'll close the public comment period and move on to item number 4, someone to approve the agenda.
So moved.
Motion made by Johnson. We need a second.
I'll second.
Second by Nimitz to approve the agenda. Anyone want to make changes or anything? All those in favor of approving the agenda say aye.
Aye.
Aye. Opposed? The agenda is approved. Last month, we didn't have a quorum, so we weren't able to approve the February Board of Health minutes. Is there a motion to approve?
I'll make a
Oh.
motion.
This lost after Kim.
Ah! She's sneaking in.
Snuck in.
We just
Somebody came out and they let me in, though they looked at me very suspiciously like they didn't want to do it. But I said, look, I'm attending the board meeting on my phone right now, but I want to get in.
Oh, is that how we could see you on the screen, and then all of a
Yes.
sudden I saw a door open, and I thought, where is she going?
Yeah, so I apologize because now I'm interrupting the meeting, but I haven't attended in so long that in person that I forgot to bring my key with me today, of course.
And the door is not
The
unlocked?
door's locked.
Oh.
Yep.
Well, you are very welcome.
But here I am.
Yes,
Okay,
and we are very
continue.
glad you're here.
I'm sorry for interrupting.
No, you're not interrupting. We're just to the point where we didn't have a quorum last month, so we need to approve the February Board of Health minutes. And I'm looking for a motion to approve those.
Move to approve.
Approved by Johnson, second by Nimitz. Any discussion on those February minutes? All those in favor say aye.
Aye.
Hi.
Opposed? Those have been approved. And then Carol did take notes from our last meeting in March and sent the Board of Health notes out. There's no need to approve them because they're just notes. Any questions on the March notes? Okay, then we have a bunch of WIC policies, I believe, to approve. So I'll defer this to, I see Kayla's on, and so is our new person, and I forgot how to pronounce her name.
Intern.
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 Intern, okay.
She's not
Of-
an employee.
Oh, okay. Well, we do have a new employee,
Yeah.
but she's not online.
Right.
Okay. So we'll turn it over to Barb and Kayla.
Okay, the reason for the new WIC policies is the signing of the merger agreement between Buffalo County and Trempealeau County WIC departments. Kayla, do you want to talk about anything in particular? I'm not hearing anything from Kayla, whether she's got a connection. Pardon?
Oh.
Okay.
Hi, Sally.
So the policies for WIC are being updated. Mainly, it's to show the merger between Trempealeau County and Buffalo County. I'm not aware of any other changes in the policies, other than the nomenclature.
Barb, do you remember how many? Because I know Carol sent like about 8 attachments or something, but I don't remember exactly how many were WIC policies.
I think they were all WIC policies.
They all? Can we approve them all in one group?
I would think so.
I didn't print it out, but I did see it.
Pretty straightforward, I
Yeah.
would think. Yeah.
Yeah. So, just anybody out in the public, they were concerning the fair hearing policy, the separation of duties policy, the peer policy, the referral policy.
Waving, but it's like.
Yes, Sally?
Maybe she doesn't have audio.
We see you, but we can't hear you. I saw Kathy. We can't hear Sally. She can't hear us.
I think it's time everybody comes to the meeting. This is way too difficult.
So I best wait. I can't read what it says.
Watch your step.
Me and Kayla are not being heard. Gotcha. So do we hold up a sign that says calling for help?
Assuming, go ahead.
I was just gonna say, as far as, the policies and things that you sent us, it outlines pretty clearly several counties' responsibilities and Buffalo's responsibilities. And it seems like the biggest change is just having the 2 names on everything instead of Trempealeau County.
That's my understanding.
And,
Yeah.
but, everything seemed to be pretty clear, and especially about the funding, not having to use levies
Right.
and things, so I thought it was pretty straightforward.
Yeah. I agree. Right.
The only two I would question whether you could include in that vote tonight would be the disaster and the interpreter policy. It says we'll update and provide at later meeting. Those two should probably be excluded from the vote
From my
tonight.
list, when they get on, I'll go
Yes.
through the list again.
Sally is trying to talk. Probably something to see if it
I don't have her phone number either to give her a call. To say they're working on it. Oh.
Welcome to WebEx. Enter your access code or meeting number followed by pound. Enter your attendee ID or the meeting.
They're working on it. They went to get Daryl, so we're in pause until we can hear from you.
Has joined the meeting.
Okay. My main concern was that I heard Kayla trying to reach out, and I want to make sure that she's able to communicate. But yes, I can hear you guys.
Okay.
You just can't hear me.
say something? Sally, say something again.
Can you hear me?
The little
Yay.
Yeah, the problem is we've got an echo.
Better?
She can't see anything now. There might be a little bit of an echo through here.
Kayla, you can hear them though, right?
Yeah, I can hear them.
Okay.
We can hear you.
They must be working on something because that echo was wild.
That's on mute, so it's
Okay, so there's an
basically.
echo. I don't hear the echo.
I don't either.
Can you,
I don't hear it anymore, but.
can you hear us at all?
The yay, it was like, yay, yay.
Oh, bad echo, okay.
Can you hear us at all?
The COVID committee. Yeah. It was the county boardroom that couldn't be heard. Everybody else hearing remotely could be heard. So,
I don't think they can hear us.
Can you hear us?
Kind of
Because if you put this mute microphone on mute so that it wouldn't echo, but then that
I'll
means it's
get
not
those things
actually
worked
picking
out
us
soon.
up.
now I can't see anything. So.
Yeah, they're not on the page for me either.
Yeah, that's what I said. We weren't, you know,
So
on.
the other person running this call is my intern, Gil. So Gil, welcome to county government.
Well, thank you. Never own the meeting.
He might decide not to go into county government.
Yeah, now I don't see anything, so.
We should.
Try it now. Now, Bill.
Sally, Kayla, can you hear us?
Yes?
Yes?
So,
Picking you up through that part.
through over here?
I'm hearing us with you.
Because we can hear you as long as you can hear us.
Yeah, we can hear you. We just, we're.
Okay, we don't have the echo.
Well, whether we fix it, whatever it is.
Okay, so,
Whoever fixed it.
Hey, Kathy.
yeah, we are taking a look at number 7, approving the WIC policies, and we're going to do that all as a group. So I'm just going to read through them for anyone else who might be listening out there. The fair hearing policy, separation of duties policy, peer policy, referral policy, low hemoglobin policy is obsolete. The benefit issuance without physical presence policy is obsolete. The equipment policy is obsolete. The multi-month issuance policy is obsolete. And the wicchealth.org policy is obsolete. So we're going to postpone the disaster plan policy and the interpreter policy because they're still being worked on. And if Kayla wants to say anything about those, that would be fine. Otherwise, we said we only really updated Trempealeau and Buffalo County.
Yeah, that's correct. So most of them is just to make sure that it reflects the Verge project. With the exception of the peer policy, there were just a few more updates in that one to reflect what we are currently doing. Really based on the pandemic, things have changed a little, so kind of reflecting that.
Anything else, Barb, you want to add?
Nope.
Then we would need a motion to approve all of those updated policies.
So moved.
Dr. Bradenbach motions, we need a second.
Second.
Mr. Johnson seconds. Any other further discussion?
Just so I'm clear, that's excluding the final 2.
Correct.
Okay.
Not the disaster plan policy or the interpreter
Okay.
policy. We'll look at those in
Yes.
the future. Anything else? All those in favor of let's see, 1, 2, 3, 4, actually 4 policies, because then 1, 2, 3, 4, 5 are obsolete. So all those in favor, please say aye.
Aye.
Aye. Opposed? Those have been approved. Does somebody want to introduce our intern person? So we know who else is with us tonight or not?
Sure, I can introduce him. So I asked Gil to attend this meeting tonight just so he could learn a little bit more about public health and kind of what we do beyond just our normal WIC clinic. So he's just coming here to listen in and observe. So he's working on an internship at Turtle and will be graduating in May and be able to sit for the registered dietitian exam.
So a potential employee, we hope.
I hope so.
Thank you for that introduction. We are on item number 8. We have a closed session, so I need someone to read the statement about going into closed session when he or she is making the motion.
I'll make a motion to go into closed session pursuant to Wisconsin statute section 19.85, paren 1, paren C, to consider employment, promotion, compensation, or performance evaluation data for employees in the health department.
And then a second.
Second?
So a motion by Mr. Johnson, second by Dr. Bradenbach to move into closed session. We need a roll call. Killian will say yes.
Emmons, yes.
Johnson, yes.
Breidenbach, yes?
Nelson, yes.
Miller, yes.
So we have everyone agreeing to go to closed session. It is 6:18.
To open up.
To open, Ron
To go
made the
into open
motion,
session.
and then
I'm sorry.
Pam seconded it, and it was at 6:28. A roll call vote, everyone voted yes. We're back live, so we're on item number 10, and any action and discussion, or discussion and action on the item we discussed in closed session. So is there someone who would like to make a motion to affirm our decision in closed session?
This is Miller. I make a motion to affirm the decision made in closed session.
And we need a second?
Second.
So a motion by Miller, seconded by Johnson, to affirm the decision made in closed session. All those in favor say aye. Aye.
Aye.
Opposed? And that motion has passed.
Thank you.
So now we get into number 11, review and update on the Kova status, department issues, testing, school update, and vaccine distribution.
Okay, the turnout for our National Guard Annex has been fairly miserable. I had notified the state that we were going to discontinue it because of the low turnout. State has twisted my arm and applied some pressure so that we are back to doing it once a month rather than twice a month, with the National Guard coming out. Their argument is basically that we are picking up some minorities who are showing up at that testing, and that even though there's a small number of them, that they want to see the test results. In talking to other health officers, I've discovered that we are not the only ones that state has convinced that they need our testing site. So we had a testing site last Friday. There were 11 individuals who showed up for testing. One of those individuals tested positive. The others tested negative. Our next test is going to be May 14th. And it's basically a Friday, and it's at the annex. What the state did do is they sent out a very small National Guard team rather than the full, I'm not sure the proper word, platoon, or rather than the full group of them. Schools are continuing to require masks at school. And we had, this morning, there was a lot of activity regarding vaccination. what has happened is, I'll read you part of it. The CDC and the FDA have issued a joint statement on the Johnson & Johnson COVID-19 vaccine. As of April 12th, more than 6.8 million doses of the Johnson & Johnson vaccine have been administered in the U.S. The CDC and FDA are reviewing data involving 6 reported cases of a rare and severe type of blood clot in individuals after receiving the J&J vaccine. In these cases, a type of blood clot called cerebral venous sinus thrombosis was seen in combination with low levels of blood platelets. All 6 cases occurred among women between the ages of 18 and 48, and the symptoms occurred 6 to 13 days after vaccination. Treatment of this specific type of blood clot is different from the treatment that might typically be administered. Usually, an anticoagulant drug called heparin is used to treat blood clots. In this setting, administration of heparin may be dangerous and alternative treatments needed. The CDC and ACIP, which is the Advisory Committee on Immunization Practices, are going to hold a emergency meeting tomorrow, and in the meantime, we have all been told not to administer any more Johnson & Johnson vaccine until they have had a chance to review all the data. What we're looking at here is 6 cases among 6.8 million. So it's an issue of trying to figure out what's happening and if there's any commonalities. So at this point in time, the first time that the health department received Johnson vaccine was last week. We administered roughly 50 doses of it. We do have more upstairs, but at this point in time, it's just being held per the instructions from CDC, FDA, and the state of Wisconsin. We do have a vaccine clinic scheduled for tomorrow at the annex. I believe we have in the neighborhood of 70 doses of Pfizer, which we will be administering out there. Anybody who had signed up for the Johnson & Johnson will not get any. We are going to try to move some of them into the Pfizer category. And at this point in time, that's really all I know. The state is using the word paused, so to give them a chance to look over the data and the VAERS reports. The symptoms that are being that were common to these are severe headache, abdominal pain, leg pain, shortness of breath within 3 weeks after vaccination is what was being reported, so that you are aware of that. And again, we want to put out that these are very, very rare, and they're putting everything on hold just as an abundance of caution until they get a chance to look at it. But I wanted all of you to be aware of that. I have also gotten a note from our HERC representative, Bill Klemp. HERC stands for Health Emergency Response Coalition. It is a coalition in this region of hospitals, clinics, as well as public health departments. There seems to be some initiative among anti-vaxxers to make appointments to get vaccine and then not show up as an effort to spoil vaccine and to they would end up preventing people from getting it. It's my understanding, according to the same memo, that there is a big meeting this weekend that may result in more situations of this. Right now, we did have last week, I believe it was 2 or 3 no-shows with no explanation. But we will continue to stay on top of that in an effort to not waste any vaccine. So far, we in the health department has not had to waste any vaccine as a result of someone who didn't show up. We were able to use our on-call lists. I do want to point out that we did have open slots because the demand for the vaccine is going down, not only in Trempealeau County, but I'm hearing the same thing from other health officers. So that you're aware of this. It's going to be kind of tricky trying to figure out how much to order and whether, again, we're back to we don't know what we're going to get. But we did receive both Pfizer for tomorrow. I think it's in the neighborhood of 70 doses, and we also received some more Johnson & Johnson, which our instructions are just to put in the refrigerator and hold. The refrigerator would be the normal storage conditions for the Johnson & Johnson vaccine. And that's basically all I have. Any questions? Yes?
Just a question regarding the Pfizer vaccine and how you're handling that.
Okay. The Pfizer vaccine is given, there's 2 doses. They are 3 weeks apart.
I mean storing.
Okay. The Pfizer vaccine needs to be kept in a deep freeze. That deep freeze is up in Eau Claire. The 120 hours that we have to use the Pfizer vaccine starts when it is removed from the freezer up in Eau Claire. It can be stored at 5 days, which is 120 hours, at refrigerator temperatures. Okay. Once it comes out of the refrigerator temperature, it has to sit and warm up to room temperature for a couple hours before we are allowed to mix it. Pfizer is a 2-part vaccine that has to be mixed. At that point, then we have 6 hours to get into arms. So what we normally do is we bring the morning doses, or the doses that we're planning on doing in the morning, to the annex, because we have more than 6 hours, and then anything that we were planning on administering in the afternoon, we would come back, we would pick it up from the refrigerator at lunchtime. So that, again, that we're well within the 6 hours.
Thank you.
We have started conversations with the jail in terms of immunizing inmates. There's no firm plan yet, but the conversations have started. Any other questions?
A question came up. We had an ADRC meeting this morning, and the question came up, are there any school children being vaccinated yet in Trempealeau County?
Right now, Pfizer goes down to age 16 as the youngest that is approved for doing done. We do have a few 16 and 17-year-olds who have been vaccinated with Pfizer. I believe that most of them are probably associated with maybe a long-term care facility where they're working as an aide or in maintenance. I don't know that for a fact, but we do have a handful of 16 and 17-year-olds that we have immunized.
Thank you for that. And then I wanted to share, they handed out at the ADRC meeting this morning, residents who have completed the vaccine series. Trempealeau County has, for people 65 and over, we have 85.3% completed the series. And Trempealeau County, who has received at least 1 dose, is 91.8% of people 65 and over. So ADRC was pretty happy with those numbers.
Yeah, and I think we have our partners out there to thank for this. We have Gunderson Tri-County, who is partnered with us, as well as Mayo. And like I said, we just have some great partners helping to protect our citizens in this county. We are planning on doing an outreach into the Hispanic community to see if we can pick up more of them, because right now they are underrepresented in COVID shots. We're hoping that that's going to happen within the next couple of weeks. The general plan is that, and would you like to talk to this, because it's my understanding you're involved, Dr. Bradenbach.
I don't have all the details, but I think there are 5 sessions.
Do you have your mic on? Otherwise Sally won't be able to hear it.
It's red.
Is there needs to be read?
Yep.
Oh, you can? Okay.
Okay. So there are 5 sessions scheduled in the next 3 weeks. I think 2 in Arcadia, no, 3 in Arcadia, 1 in Whitehall, and 1 at the GET High School. And there will be a clinician there, either from Mayo in Arcadia or from Gunderson, Tri-County, to give a brief presentation, 10 or 15 minutes, about the vaccines, and then answer any questions that community has. So those sessions are available to the public. They're all being held at the local high schools, so partnership there with the school districts as well. And then 2 of the 3 in Arcadia will have Spanish interpreters present to be interpreting all of the questions and everything that we're saying. So the target of that is to try to help the people in the community who might be unsure about whether they want to be vaccinated or not to get more information, and to specifically get a little bit more information to the Hispanic community, which, as Barb said, has been under-vaccinated in comparison to the rest of the county. We also, at Tri-County, have been over at Pilgrims, not vaccinating, but talking to their staff about getting vaccinated and inviting them to come to the hospital, and have had some success with that. And I do not know what the vaccine plan is at Ashley. Maybe you do, Barb?
Last I heard that the clinic in Arcadia had applied to be a vaccinator, but I'm not quite sure what happened after that. I will confess that I missed the last meeting with Joni Olson.
Yeah.
I will point out that at the outreaches that Dr. Kim and Dr. Hodis are working on, our interpreters will have laptops where they can actually register. Right now, we are all feeding off the same wait list. The wait list is being generated online on our website. You can sign up in English and in Spanish. And Gunderson, Tri-County, Mayo, and the health department are all pulling and making appointments off of this list. At these outreaches, there will be people there with computers, with laptops, who can actually register the clients right then and there onto the website waiting list, so that we can pull their names and get them registered for shots.
That's great.
Barb, this is Sally.
Yes.
I just went onto the website to try and to just go through the process. I am taken to the old TrempealeauCounty.com website from DHS, where it says connect your local health department. So that takes me to DHS. When I click on Trempealeau County, it takes me to TrempealeauCounty.com, which of course is no longer a valid website.
DHS is the wrong one.
It's the wrong link.
So
just Google Trempealeau.
that might be something we want to get fixed, because it's
Okay.
sending people to a dead site.
Yeah, if you Google Trempealeau County,
Right. No, I'm saying when I go to our county website and the health department website, it takes me to a link that takes me to the state, which takes me to a map of the state, and then I click on our county, and then I'm sent to a dead website.
okay, I'm going to ask
website.
Kathy to help us here.
Sally,
Yes.
DHS has the wrong link to the Trempealeau County website. If you
Yeah,
Google
when you
Trempealeau
go-
County, you'll find the co.trempealeau.wius website. That's our website.
Right, but the link you see on the, what I'm saying is on the COVID page, when I follow just doing what I would do, going through it, it takes me to the DHS website, which says where can you get vaccinated, and it shows links including the health department. When I follow that link, I
Yes.
end up at the TrempealeauCounty.com.
And DHS has been notified that that link is incorrect, and they
Okay.
need to correct that.
Okay,
Okay, good. That's why I was like, ew, I don't know what to do at this point.
Yeah,
Until I
if-
realized what it was,
Just
so.
go right to the
Yeah, if you
Trempealeau
guys
County
have already
website.
notified them, that's,
Yep,
Yeah.
and as you follow it, it's going to say vaccine info on there, and that's what you click on, and it takes you right to the forms to fill out.
Yeah, just straight onto the Trempealeau County Government Center website.
So where is that, on the front page?
If you go to the Trempealeau County website, you'll see in the bottom corner, it'll pop up a pop-up that says vaccine and coronavirus information, and you can click on that, and that'll take you right to it.
Okay, so then when I get there, what do I sign up for? Because
If you
I'm
go to the
having a hard time,
vaccine
I wonder if
page,
others are.
yep, there'll be a green button that says vaccines, and you click on that, and then when you scroll down, there'll be a link that says English, and there'll be a link that says Spanish for signing up.
Yeah. Well, it doesn't surprise me that I'm having a problem today. This has pretty much been my whole day.
Sally, I don't know that it's exactly you, because over the last few weeks, I've had at least 4 people who have called me who either didn't have computers or couldn't figure out how to get on there. And I basically asked them if they were comfortable with me registering them.
And IT can look at it tomorrow, and
Yeah.
maybe we can make the vaccine sign-up button a little more easy to find.
Yeah.
I'll work with Kayla on that.
Okay.
It says vaccine information, and then I click on that, and for whatever reason it takes forever, but English and Spanish, and then I'm back at that page that sends me to DHS, where I followed the link. So I'll keep playing with it, as long as you guys are aware, but I'm having a hard time getting to the page to register, so I just wonder if others are.
Okay.
So yeah, just wanted to bring it to your attention.
Thank you.
Anything else about COVID issues? Then Carol is up for number 12, review of the agency vouchers and the budget.
So on your copies, which is the Board of Health voucher, I wanted to call your attention to the, this is ran from the last Board of Health meeting. And as you can see, we still have contact tracers, which is in that first category of the public health COVID. This will be all monies that will get reimbursed to us once I figure out the contract to bill each one under. And we do have another one besides interpreters. We are using the language line, which I believe I did mark that on yours. It's on the first page. That's a nice source. When none of the interpreters are available, our contact tracers has access to the language line. And that is just for, 165 is just for 1 month billing. So to move on, I didn't, want to, there's really nothing big here, but I just wanted to call different things that we encounter while doing it, just different things. Let's see, I don't have the one that's marked. I gave it all away.
Did you give it to me? There's marks on mine.
Yeah, I think I did. Again, there's the second half on page 3 of our contract tracers. Okay, thank you. Oh, here's one. On the front page, we have a $45 bill. This is for printing our forms. That is a little bit of, I don't think you've ever heard about our rabies. We follow up on dog bites, which is a regular 3-part form that's used with the Sheriff's Department and the municipality law enforcement. So that was the reason why I flagged that. I just wanted to show you that we are involved in other things besides COVID, if we remember. Otherwise, that's pretty much all I have for vouchers this month. And as far as our agency report here with our budget, things are going fairly well. We are starting to open up. More inspections are getting done. Our TB area is being used more. So you'll start to see these numbers increase more. So, thank you.
Any questions for Carol? Thank you for keeping our finances in check. Then if you pull out your calendars and look to next month for May, the Board of Health meeting, May 18th, third Tuesday, any conflicts? 6 o'clock, May 18th.
Do you want that in the county board room yet, or do you want to meet in the health department lobby where we used to meet?
Good question.
I think we should continue to meet here with more space.
Okay. So I'll be down here in the county board room.
I'll reserve it.
Okay. And we are at the end of the agenda, and my phone says 6:54. So I will adjourn the meeting, and thank you everyone for coming. So we had a quorum tonight.